Hello, everyone. Thank you for being here. This is our third and final in the series of Q&A sessions with our medical experts discussing COVID-19 and COPD. We are joined by Dr. Barbara Yawn, Dr. Byron Thomashow, and Dr. Valerie Press. Thank you all for being here with us. Let's go ahead and get started. So, Dr. Press, the question for you is, I have heard that we should be ready for a second wave of COVID-19. Are we more prepared now to fight the illness?
We have really learned a lot over these months. We have so much more to learn. And so in theory, we should be better prepared for a second wave. And what I mean by that is we do know so much more now about what kind of protective gear healthcare providers need to be wearing, what kind of gear our patients need to be wearing, like the face masks we've been discussing. And we have some treatments that are available, especially to our sicker patients in the hospital. And we really do know that this social or physical distancing, quarantining if you know you're sick or at risk, wearing face masks and things like that really do work. I think my reason for the yes and no is we may know these things, but putting them into practice may be difficult. So we've had limitations on the protective gear that we can access. As was mentioned, we don't still have great access to N95s and other gear. The testing needs to be improved. Again, we do have testing, but we need it to be better and faster. And so we really need to work on our streams of accessibility to what works. I would also say that every time that we expand, we loosen up restrictions. So we're now allowed to go to the hair salon, and then we have to pull back. That's just going to be very difficult for our citizens, for people living in our communities to start up activities again and then pull back. So yes, I think overall, as we have second waves, and many will argue as a country, we're not out of the first wave yet, that we should be better prepared. And as time goes on with more vaccine development, more treatments, and hopefully more production of the gear that we need, we'll be better prepared. But I do think we need to continue on our messaging. I think we need to continue on our access, and I think we need to be supportive of the feelings everyone's going to have about being isolated and what that means for our social interactions, learning and education, our ability to work, and our economy. So overall, yes, but some caveats.
I agree with everything Valerie just said. The only other thing I might add is that it's obviously been difficult to get our patients to get flu vaccines. There's been there's been a negative connotation with them. They don't really work that well, et cetera, et cetera. This is one of those years where I think everybody should try to get the flu vaccine as early as possible, because the concept that you could have both another flare of the COVID-19 and a flu season is a scary concept. So people should take advantage of it.
I'm really glad you brought that up, because one point that I meant to mention on this topic is part of being prepared for the second wave is doing everything we can, if it does happen, to not overwhelm our systems. One of the ways that we can take care of patients if they get very sick is by giving them the care they need in a hospital setting, either on our regular floors or in our intensive care units, and possibly with the ventilator, even if we try to avoid that. And if we have too many patients to take care of, we can't give them all the care that we can't, that we could provide otherwise. And with something like influenza co-occurring, that's going to further strain those resources. So I could not agree more. Every effort needs to be made to get patients the vaccines we do have, like flu vaccine.
And also, if someone has influenza, the symptoms can certainly very much overlap with COVID, and it makes it very confusing. So if you at least give yourself the best chance possible to avoid the influenza, so September, October flu shots for as many people as can possibly get them. And actually now we have the live attenuated influenza for children again that's approved. And so please protect yourself from everything that you possibly can, and influenza is one of them.
Great points. Very, very good points. Very well taken. Thank you. Dr. Yawn, I have a question for you. This question says, can I take hot water during a COVID infection? And to clarify, I think they mean drinking hot tea, hot coffee, hot baths, that type of thing.
Yeah, there was a concern about this, apparently, that raising the body temperature would raise inflammation. Well, it's really kind of the other way around. When you get an infection and the body has an inflammatory response, part of that inflammatory response is a fever. So I am not concerned about somebody drinking hot tea, coffee, hot chocolate, any of those things, or taking a reasonably hot shower. If you take too hot a hot shower, you can make yourself very lightheaded. And so don't do that. And of course, you don't want to burn your skin. But it is not a concern that these things are going to modulate or change your immune response by raising your body temperature. It's pretty hard to raise your body temperature a great deal by just drinking coffee, but it is not a concern. That's what we do when we need some comfort sometimes, and by all means, use that for comfort.
So this will be the last question that we ask for this particular event, but I do want to stress that if you ask a question and didn't hear it answered here, you'll be able to find your answer in written form on the blog post. So don't think that we were avoiding your question. We've just simply run out of time. So Dr. Thomashow, this last question is for you. What are early measures that I can take in case of suspected COVID exposure to avoid progression to severe disease?
I wish I had a definitive answer for that, Stephanie. There isn't a lot that you can do. I think it's important to stress that most people who have this will get through it okay. You know, that not everyone ends up in a hospital, not everyone ends up in an ICU, not everyone ends up on a respirator. Many people, it behaves more like a typical viral infection. I think the key point from my standpoint is that whatever medical therapy they're generally on, that they should stay on their regular medical regimen, because I think that gives them the best chance of getting through this. I think that they should talk with their primary care physicians in advance about what should I do if you have early symptoms, because they will know you as opposed to Barbara, Valerie, and I who don't know you. They will be able to give you some advice. You should find out whether they want you to call. As Barbara said, calling early is probably a good idea, even if you're not sure what's going on. The concept of getting tested, as Barbara mentioned earlier, is a good concept and worth doing, even though we're still working through some of the issues with testing. I think most of us are continuing to avoid non-steroidals because there was some early evidence from Europe that non-steroidals might make things worse in some form or fashion. So we're tending to use more of the acetaminophen, the Tylenol type of drugs, although Valerie and Barbara might have some comments about that. I think the key thing is to not panic, to not get too scared, to understand that everything is going to be okay, and to work with your family and your providers to make that happen.
And to also quarantine, so that you make sure that if you think you have COVID, that you don't share it with anyone else. But I think your points are really, really important, is that most people really do not end up in the hospital, do not end up in the ICU. Most people can be cared for at home with support.
Yeah, I think those are great points. The only thing I'll add is not something that can be done right now, but if we talk about things that are on the horizon or things that we hope become a resource, would be, in answer to this question, a medication that we could give if you do have an early exposure or early symptoms. So in the case of influenza, we have a medication that if you're very, very early, you've been exposed or you've had symptoms very early on, that we can give to help lessen the impact. It doesn't really cure it, but it helps lessen the impact. And there's hope that we can find a medication that could be provided similarly, such that you have a known exposure or you have very early symptoms. Those are still being tested and developed. So again, we don't have that right now, but in the future, we may be able to take measures like that early on. But other than that, I would agree.
And I did want to comment on Byron, you were saying avoiding the non-steroidals, just in case anybody doesn't know what the non-steroidals are. We're talking about Aleve, Advil, those kinds of medications. And I think if you can use the acetaminophen and that gives you the relief, then I would go that way, absolutely.
It's interesting, Barbara, Valerie. I haven't actually not heard much at all about that since the height of the European peak.
Right.
There's been very little about that written subsequently. I don't know whether you or Valerie are aware of anything more that's come out.
No, there was one report that was less worrisome, but it's not definitive. And I think with the early findings, what I do say is, again, as we've been sort of saying over and over again, for any individuals that are listening to this and you're wondering about should I or could I take one of these non-steroidals like an ibuprofen or an Advil, ask your doctor, because there may be instances where for your quality of life or to be able to stay mobile if you need to walk around and you need it, that they may recommend continuing it. I think the concept here is there was a question raised if these medicines could be worse in case you got the infection, and that question hasn't been answered. So there was concerns about it. I've not seen anything more definitive to your point, but I do think it's a case by case with patients.
Yeah, I think that's a great idea.
Yes, I agree completely.
Thank you all. So I think just to recap, stay home if you can. If you can't, wear a mask. Don't get close to people. Outdoor activities are better than indoor activities. But if you have been sick enough that you feel like you should be tested for COVID-19, please self-quarantine until those results have come back. So does that about sum it up?
Don't forget to wash your hands.
Wash your hands. Wash your hands.
Don't be afraid of seeking medical care if you need it for any reason, whether it's chronic maintenance health or for acute issues. We want to be able to take care of you if we need to.
Great. So thank you so much for joining us today. Again, if you have any questions, you can visit our website at thecopdfoundation.org and visit our section on the coronavirus updates. Thank you, and bye-bye.